Implants are a fantastic restorative option. Actually, it is the best restorative option in most cases. Why do I say most cases? Because not every patient is a patient that is suitable for an implant restoration. If there's not enough space between the arches, if the top teeth and the bottom teeth, there's not enough space, or if there's not enough bone, the patient may or may not be able to go through the implant process. Okay. If a patient is experiencing problems with an existing implant, we need to figure out what the position of the implant is, how long the implant has been in place, and what is the patient going through at that moment. Has the restoration that's on top of the implant, because as you will know, the implant replaces the root of the tooth. Okay, so an implant is basically a replacement for the root, which will receive a restoration or a crown on top of that, or a denture or a hybrid denture, different types of restorations on top of that. So we look at what's going on with the implant. How is the bite affecting that implant? Is the implant in the correct position? Is the implant in the correct angulation? Because if not, that's going to make a difficult position for that implant, a complete failure of the implant. So as we look at that, we need to look at how is that implant going to affect positively or negatively the patient, depending on the patient's needs at that time. With the implant, I don't do the surgical part. There's a surgical portion where the implant needs to go into the jawbone. That either the periodontist or the oral surgeon will take care of that, and we work very closely with those two specialties. Then the patient comes to me, where we actually take a mold or an impression of the existing implant so that we can restore that implant so that it harmonizes with the rest of the teeth in the patient's mouth.